what is NAD and why is that important? You touched on that you're checking that now also with your regular blood panels. But why is NAD important?
NAD is important for tons of different reasons at this point. It's an enzyme that works in part of the mitochondrial pathway. It works as part of your energy pathway, your anti-aging pathway. It helps your body produce ATP. It helps your body potentially with weight loss. So it's important in a lot of different ways. It helps your body heal DNA. It helps your body as well, potentially with preventing cancer by acting P53. It does so many different things in so many different ways. That's important. We don't know. There's a big debate now what form to take it in. I mean, people may have heard of things called NR or nicotinamide riboside versus NMN. There's still debate, and a lot of that depends on which company you're listening to at the moment. I'm a big NMN fan as opposed to NAD. The studies are just a little, the NR fan, the studies are just a little bit better at this point. But I think patients should be taking it. If you're going to take it, again, you can do it orally, you can do it as a patch, you can do it as IV. IV is a lot longer, it takes about 3 to 4 hours. It's a lot more expensive. It could run you, depending where you are. I know in the city, it could be up to $1,100 a treatment.
Wow.
So it's not cheap. It works better. It works better for things like addiction and brain fog and healing. But if you're going to do NAD now, what we know is you also want to make sure you're taking the boosters with it because it helps amplify the effect. Because otherwise, NAD will kind of dissipate pretty quickly. If you take things like a Pigeon or quercetin or Ficidin or Astragalus, that'll increase the boost that you get initially, and also will will slow down how much the NAD decreases over time.
So you're doing a booster. Is that like a supplement booster that you're taking that just kind of keeps it from basically being metabolized, or how does that work?
Exactly. Yeah, there's different. It blocks something called CD38 from breaking down. So bring down the enzyme.
Okay.
So they all work. None of them come together, unfortunately, but you can get them piecemeal together.
Okay, so if somebody's going to take NAD, whether they go into your office or a cream, or are they injecting it themselves too? There's all these different options.
Yeah, I mean, most commonly now, most patients are doing the self-injection, honestly, or they're doing the pill, and they'll come in once every 6 months and do the IV. It's just because of the time commitment at this point. So a lot of people are just self-injecting like 2 or 3 times a week. And they're done. Like you said, most patients now, or at least my clientele, is very comfortable injecting themselves. It's like nothing for them. It's like, okay, take my vitamin D, my vitamin C. Oh, let me give myself a shot at NAD, and I'm good to go. So it's amazing. 2 years ago, everybody was scared and like, what are you talking about, Paulvin? And now it's like, it's not a big deal at all.
Right. I love that we're at that point now of just complete body optimization, and we're going more towards that. Now, when somebody's taking NAD, what's the time frame of when they start feeling better? They have more energy, more clarity. What do you normally see with your patients?
It depends on the form, honestly. If you do a shot or you do the patch or the IV. I know I do, and a lot of the patients will feel something pretty much right away. It's kind of a short-term burst, and then you'll feel a gradual improvement over time. It may not be that same peak, but you're still definitely noticing improvement.
Yeah.
The patients who do some of the pills are not. It takes a lot longer to get the level up in the bloodstream. So that may take a couple of weeks to a month or so.
Okay.
I've had patients tell me that, okay, wow, now I'm starting to feel it. They're also taking lower doses, so it takes a little bit longer for it to kick in.
Right. And is this something that you can just take indefinitely, or how long should you take it, cycle off it?
It depends. I mean, the pills you take continuously right now, we don't know any different.
Yeah.
In terms of the IV, you should do 4 to 5 the first 2 weeks that you ever do it. And then I have patients doing it pretty much every 2 to 3 months in a perfect world. The shots, though, people are doing it in perpetuity as long as they're getting the benefits from it. Yeah. If sometimes patients will say, hey, look, I plateaued, I'm not getting it, then I'll just take them off for a month or two and let their body kind of recycle and then put them back on.
Okay. What about for athletes? Is there anything that they need to be concerned about with testing if they're taking NAD?
Technically, it's on some list. If you're a professional and you get tested,
right.
Be really careful with the NAD. Depends on what your organization is saying. It's and some will say different forms are okay. It a lot of this stuff is in a very gray area right now. Why a lot of athletes like it at this point, because
Sure.
a lot of this, but there are athletes who take it. Yes, plenty of athletes who take it and get benefit from it.
Yeah, I mean, if I was willing to guess, I would imagine that the majority of the NFL is on some sort of peptide. I mean, in almost any other sport now. I mean, why would you not, right? It's just the side effects are almost non-existent, and you're healing faster and moving better, and joints feel better. I'm making $10-20 million a year too. I'd probably be doing the same thing.